Well, the holiday break is over for our nation's leaders, and many of them are back to work now in Washington, D.C. And joining us from there is New Mexico Congressman Ray Lujan.
Thank you so much for joining us this morning. Now, you just wrapped up a trip here in New Mexico. What were some of the things that you heard? What were some of the feedback that you got from our residents here in the state?
Well, Deanna, good morning, and Mike, good morning. To you as well. As we had an opportunity to travel around the district, we concentrated a lot of our discussions on energy and health care this trip. And I'll tell you, as we had an opportunity to visit with some of our constituents at some of the meetings around the 3rd Congressional District, it was amazing to hear some of the stories and how health care and the high cost of health care is hurting people today.
And as far as what they're saying, I mean, are they in favor of major health care reform, or they're talking a lot about the price tag of getting this reform in place?
You know, Mike, for the most part, people are very much in favor of making sure that we have a strong public option included in the health care reform, that we're looking to get those that are the most ill, that those that are sick, the ability to get some coverage, and even those that are taking care of their kids, or some of them that are taking care of their parents in their home, where the costs are just out of control, and they're worried about that. They're worried about not being able to afford to keep their family, their loved ones sick. And you know, Mike, most of us are just one illness or one injury away from losing everything. And we need to make sure that we get health care to everyone, but more importantly, that we're able to keep costs down and help those people that are struggling today just to make ends meet, and to see how we can help our businesses, small businesses out there, be able to afford things a little bit better.
So if you were going to pick a solution, what would it look like?
Well, you know, I was a co-sponsor of Congressman Conyers' efforts to get health care moving in that direction. But what's being discussed today is if you have the coverage that you like today, you can keep it. But that we need to build a strong public option that will provide a certain level of care, that will eliminate pre-existing conditions so that people that are sick won't be discriminated against or be kept away from getting coverage, controlling costs, making sure we're being smart about that, and adding consumer protections, similar to what we did out in New Mexico, working with the New Mexico legislature and the governor, to be able to look after some of our patients and our consumers out there so that insurance companies won't arbitrarily deny coverage and keep them from getting the coverage they need.
The nation continues to lose a lot of jobs, about 9.5% as far as the unemployment rate now. And there's talk again, at least in the House where you're at, about maybe another economic stimulus package is needed. Do you think another package is needed?
Well, you know, Mike, we read some numbers again today about a concern with job loss numbers. And I'll tell you, the good thing about what's happening in New Mexico is as we've traveled to some of our rural health care facilities, they've already received some stimulus funding. There's road projects that are currently underway, and we're working with the governor's office just to keep an eye on how some of the funding is getting out. New Mexico's job unemployment numbers aren't as high as the rest of the nation, but it's something that we definitely need to be aware of. And I'll tell you, we need to make sure that we're able to get this funding out, we're able to create the jobs that are needed, as others may be considering looking at what we need to do to continue to keep our eye on the economy and make sure that we're moving in a direction where we can get the economy moving in a positive direction with getting some job growth numbers. But we're continuing to monitor what's happening now and make sure that we're able to best take advantage of the recovery funding today.
So are you saying you think a stimulus plan or another layer of it is a good thing, or really we don't need to do that right away?
Well, Deanna, I think it's important that we look to see how the next 100 days are going to go with the anticipated creation of potentially 600,000 jobs around the country, of saving or creating 600,000 jobs over the next 100 days, are the numbers that we got last night and early this morning. And it's important to take a look at that to see where we are. But I'll tell you, we need to keep our eye on what's happening with the economy. We all know that this is the worst recession since the 1930s. And as a nation, we need to make sure that we're providing job opportunities and doing what we have to do to create those jobs. With the adoption out of the House with the Clean Energy Act, it's important that we look to see how we can take advantage of some of the investment of the Recovery Act, especially out in New Mexico, where we've gone so far ahead of energy policy, and we can create some good jobs out there.
Well, the economy and health care, two big issues, will continue to follow. Congressman Lujan, thank you so much for being with us this morning live from Washington. We do appreciate it.
Mike and Deanna, good morning to you as well, and it's an honor to be with you. Look forward to talking to you soon.
All right. Well, thank you very much, and we'll be right back.